Introduction to Nursing Concepts, Medical Terminology for the Caring Unit with mental health terms used as well. As we look at the caring unit, we think caring is really the core or essential part of nursing. It's how we make people feel. When we have caring attitudes, we make patients feel better. When we have trans culture, trans is across cultures. It's part of understanding our patients that we care for. Maybe they have a very different cultural background and very different beliefs or attitudes about healthcare. Presence is just being there. It's a form of caring, and it's not necessarily talking, but it's just saying, I'm here for you. And having presence is very therapeutic. Neuropathy, neuro is nerve, pathy is disease. When we have a patient with neuropathy, could be a cancer patient, it's usually kind of a painful condition. We also think of neuropathy with the diabetic. Cancer-related fatigue can be from many things. Perhaps they're anemic. Perhaps they're doing chemo and radiation that's causing a lot of fatigue that goes along with that disease. Bio is life. Biotherapy then would be the treatment, promoting or prolonging life. Resiliency is hardiness. I think of older people that have been very resilient through the years and stayed healthy to get to the age they are. When we have reciprocity, it's sharing or exchanging of ideas, contributes to the sense of self-worth for the caregiver. We think of reciprocity being used also between states when they have an agreement or sharing where students from one state can go for in-state tuition to another university in that state. So reciprocity is exchange or sharing. The colors that go with medical terminology, albino is white, leuco is white also. If you are an albino, you have no color in like your hair and eyebrows. Leuco is white, meaning like leukocytosis, your white blood cell. Chromo is color, and chrono is time, and both of those are Greek words, and they definitely help you break things down when you're looking at color and time. Melano is black, like melanocytes. Xantho is yellow, verto is green, rubro, erythritol, and erythro are all red. When we think about the skin color, we chart things like the patient is an albino if they have, like I said, the white hair, white eyebrows. Albinism is a condition of white. Cyanosis is blue. Erythema is red, and jaundice is yellow. When we combine forms, you can see the root word in there. When we have abdominal, it's abdomen. Appendo is appendix. Arterio is the artery or the vessel that carries oxygenated blood out to the tissues. Intestino is intestine. Laryngo is obviously the larynx. Musculo is muscle. Thyroido is thyroid. Tonsillo is tonsil. And veno is the vein or that vessel bringing the unoxygenated blood back with carbon dioxide to be reoxygenated. Excoriation is kind of a superficial injury, usually from something sharp. The treatment is just topical antibiotic because you've just barely scraped off the top of that epidermis. To break that word down, excorio is to take out skin, and ation is your suffix, meaning a process bringing or having. Another skin condition is scleroderma. Sclero means hard, derma means skin. It's an autoimmune disorder that causes a lot of problem for the person that has that. And we'll finish out this PowerPoint with some of our mental health terms that you might see as you're caring for patients. Your mood is how you feel, and your affect is what people notice about your mood, your emotions that are displayed. So I might tell you, I feel happy today, but when you look at my affect, I'm frowning, I have a wrinkled face, tells you I'm worried. And so mood and affect don't always parallel or look alike. Anxiety disorders. When we have anxiety, that means fear or worry. When a person has an anxiety disorder that's an obsession or they're obsessive, that is besieging by thoughts. And when we think of somebody with obsessive compulsive disorder, they do things over and over again. As part of their anxiety, they have to, check the locks 15 times before they go to bed or have everything in an exact order. A compulsion is to do. And when you have a compulsion, it's a drive or compel to do something, and that can be good if you have the drive to get through nursing school, but a compulsion can be a bad thing if it overtakes your life and all you think about is the drive in doing that, and you don't have a healthy balance in life. Some of the phobias. Phobo is fear or avoidance. And when we have acro, it's a fear of heights. So acrophobia is a fear of heights. Agoraphobia is a fear of public places. And those are people that you read about in the news or hear about on Jerry Springer that are, been in their home for 15 years, and people bring groceries and take out their garbage because they cannot leave their house. They have agoraphobia. Acrono is spider. And claustro is enclosed spaces, so claustrophobia is a fear of, being in maybe the MRI machine or in a closet or an elevator. You have claustrophobia. Our mood disorders continuing. Bipolar, bi means two, like if you ride a bicycle, you have two wheels. Bipolar means a person that their mood is either one way or the other. They're very high and happy and manic and they have a lot of energy. Or the other end of bipolar is depressed and sleeping all the time and crying and not feeling good. Mania is meaning thin or frenzy, and when a person has a mania, it's one side of the bipolar. We see where they have lots of energy, but they make irrational decisions, and they kind of just make you very nervous because they're all over the place. Dysthymia, then, dys is painful, difficult, or abnormal, and in this case it would be abnormal. Thymo is from your thymus, and it means rage, and so somebody with dysthymia has a condition of kind of difficulty with their mood, balancing their mood. It's an abnormal part of a mood disorder. Schizophrenia. Schizo means to split, and phreno is actually mind. It's a Greek word, and your person with schizophrenia, it's probably one of the most serious mental health disorders that we have. They have a very hard time fitting in with society, keeping a job, but the good news is there are very many medications and treatments that can help somebody with the diagnosis of schizophrenia to live a normal life. And our last one is neologism, and neo means new, logo is word, and ism is your process, and it's just making up a new word. When somebody has a neologism, they can't think of the word they need to say, and so they just make a new one up, hoping that you won't notice or understand the difference. They don't want you to realize they don't know what it is. We sometimes see that with Alzheimer's disease when they can't remember information. They just make something up to fill the gaps, and it's not always an intentional thing when they have a mental health disorder. The information for this comes from the Potter and Perry as well as the Turley Medical Terminology from the 2011 edition, which is your second edition. I hope this has been helpful and you have a great day.